Tell the person you are about to begin. Tell them to let you know if anything you are doing is painful or uncomfortable. Part of them being comfortable is having a feeling of trust in you. This is not the time to make jokes or suggestive comments. Periodically remind the person to take a slow, deep breath. It will help with relaxation. Pour massage oil in the palm of your hand. Start with about 1 teaspoon, which is roughly the size of a quarter. Warm it by rubbing it between your hands before applying it to the person. Good oils to use are organic coconut oil, grapeseed oil, jojoba oil, or almond oil. There are many expensive scented and specialty massage oils on the market you can try too. Spread the oil around. The main technique for spreading the warm oil across the person's back is called petrissage, which means light friction. Use gliding movements in long, even strokes. Use the whole of your hands and start at the bottom of the person's back, moving upward. Always upward toward the heart, the direction of blood flow, while applying pressure, and then lightly bring the hands down the outside of the back lightly. Maintain contact without applying pressure as you bring your hands back down. Use petrissage techniques. Petrissage uses shorter, circular strokes with more pressure than petrissage. You can think of this as a kneading technique that uses rolling and pressing to enhance deeper circulation. This technique can use the palm, fingertips, or even the knuckles in the short, circular motions. The movement should come from the waist, your core, rather than from the shoulders. This step will help keep you from becoming fatigued. Apply percussive strokes. Percussive strokes, also known as tapotement, are collections of brief, repetitive contacts with parts of the hand. You can use your cupped hands, your fingertips all gathered to an even point, or even the flat of your fingers on the knuckle side of your hands to make the contacts. These movements have a stimulating, compressive effect on the tissue. Use muscle lifting techniques. To perform this, close your fingers and hold out your thumb, in a lobster claw shape. Apply pressure in a twisting, lifting motion. Keep alternating hands in a windshield wiper movement. Move up and down the back 2-3 times. Use a fanning technique. Position yourself at the head of the table. Position your thumbs at the top of the back, just below the neck and on either side of the spine. Using a fanning motion with your thumbs extended, push gently down toward the lower back with your pressure angled at the person's feet, not down towards the ground. Alternate your pressure on either thumb, moving from the top of the back all the way down to the person's hips. Apply twists. Come back around to the person's side. Reach around the far hip with one hand, while the other hand rests on the near hip. With a fluid motion, pull one hand towards you as the other one pushes away. In the middle, they should slide against each other, in opposite directions. Repeat this stroke up the back until you reach the shoulder area, then come back down. Repeat 3 times.